if you're contracted to do, I don't know what the consultant's hours are. Are they 40 hours? Like
37.
37. Okay, so if you've got to give 4/5 of all of that to the public system and 1/5 to your private work on site, it's a very simple calculation. 1/5 of 37, 7.5 hours kind of thing. Who's counting the hours? Who's counting the minutes?
Largely nobody.
Nobody.
There's a couple of things happening. One is the hospitals have a big incentive to treat more private patients because it's a significant source of funding.
They're getting the insurance money.
Yes. And that's one of the factors driving the rise in health insurance
so
costs.
So are they turning a blind eye to, if one consultant is bringing in a lot of business, a lot of private business, and they're saying, well, there's only so many hours in the waking day, how is this guy doing it? But on the other hand, through VHI and Leia and all the rest of them, he's generating huge revenue for the hospital. Let him at it. Is that what's happening? I don't know
if that's what's happening. I do know it's not being effectively managed and recorded. And that's one of the things that came out from RTE. This information isn't collated centrally. It's supposed to be run by the hospital groups. And the hospital groups are really just getting established. They're getting their feet wet now. So they haven't been in a position to manage this for the last few years.
Yeah. If the scandal is visible to when Prime Time Investigates goes in like this, it's visible to the managers in theory.
Yeah, people will know this is going on. They may not be able to put a figure on it, but they will know that someone is doing a lot of private practice and someone else is doing much less. They're not managing the process effectively. There's no governance in place.
Now, a lot of people work very long weeks. Yeah. So if a consultant who, as you say, most of them are in the Dublin area, who have the broader, more generous contract, if they're prepared to work an 80-hour week, but they're giving their 30 hours to the public system and then doing 50 hours in various hospitals around the place, is it, well, so be it, or should we be worried about that?
Well, the RTE programme began with, I think, a very important sentence, which was that most consultants work longer hours than they're contracted for.
Yeah.
The majority of my colleagues in the consultant sector do a lot of work in the public sector. There is an issue with consultants working crazy hours, which is a patient safety issue. There is lots of data showing how your performance goes down and how your ability to manage complex situations gets worse
if you're
as
fatigued.
You work more and more hours. Yeah. We don't let people fly aircraft for 80 or 90 hours a week because it's dangerous. Fair enough, if there's something exceptional happens, there's a disaster, it happens, you get two very complex patients popping up one after another. That happens, that's part of the business. But you shouldn't be doing that week in, week out. It is dangerous. And as far as I can see, nobody's monitoring that at all. So nobody's saying, how many hours are you, Anthony Staines, working? And is that safe for you? Because the employers have a duty of care to their staff. And is it safe for your patients?